Hi, I'm Dr. Datis Kharrazian. I want to talk to you about an overlooked mechanism of infertility, which is autoimmune premature ovarian failure. Basically, in this condition, what happens is the immune system starts to make antibodies against ovarian tissue, and then the person ends up with bad follicles, and they usually end up with loss of their menstrual cycles before age 40. Typically, they show up with elevated FSH. Looks like they're in menopause, but they're pretty young. They're usually in their 30s. Now, this is one of the worst mechanisms for infertility because once they develop this condition and it progresses to the point that their FSH is now high, it's really hard to do anything for them clinically. The key thing with this condition is to identify these ovarian antibodies before the feedback loop is lost. And this is something that we're going to talk about extensively as one of the mechanisms that you need to evaluate in the Kharrazian Institute Infertility, Prenatal Maternal Health, Clinical Strategies and Treatment Applications course. Now, when you look at women that have this autoimmune premature ovarian failure response, you really have to work at their autoimmunity, but you have this very narrow window of time where you really have to look at all the clinical mechanisms that may be involved and what time frame that a woman has to be able to conceive. So as soon as you see this antibody, you want to look at FSH, and if FSH levels are still normal, then there's a window of opportunity to make sure that the patient can really focus on conceiving, and really this shouldn't be put off any later. Now, when you look at premature ovarian failure, it's really thought to be a pretty rare condition, but recent research is really showing that it's more common than we've ever thought. And also that if any time a woman has any other underlying autoimmune diseases like Hashimoto's or lupus or rheumatoid arthritis, one of the key things that absolutely needs to be differentially diagnosed in any patterns of infertility, or just for a health workup for any woman that has autoimmune disease, is to evaluate the target proteins associated with autoimmune premature ovarian failure. Again, we'll be going over this concept in great detail and many others in the upcoming Kharrazian Institute course on infertility, prenatal maternal health. Hope you can join us. Thank you.